My name is Hala Tamer Noor, and my research is about chemistry of aspirin, acetaminophen, and ibuprofen. Let's start the presentation by introducing you to the word NSAIDs, which is an abbreviation for non-steroidal anti-inflammatory drugs. It is a group of medications that are used to reduce pain, fever, and inflammation. It works by affecting the activity of COX enzyme, which is also an abbreviation for cyclooxygenase enzyme. COX-1 enzyme is located in the stomach. It is responsible for the protection of the stomach wall from the acid present inside it when digesting the food. COX-1 enzyme is also responsible for thickening your blood to prevent excessive blood loss when you're hurt, wounded, or during a surgical operation. The first NSAIDs medication I'm going to explain is aspirin. We will discuss the history of its existence, the pathways and pharmacokinetics of aspirin inside the body, the mechanism of aspirin in the body. We will also discuss the chemical structure of aspirin, how to synthesize aspirin, what medical conditions require the usage of aspirin, and lastly, its side effects on consuming overdoses. The history of aspirin started after the First World War. The influenza pandemic highlighted the drug's value and also underlined its limitations after the deaths of a lot of patients due to internal bleeding after consuming large doses of aspirin. Moving on to the pathway and pharmacokinetics of aspirin. Aspirin is absorbed rapidly by the stomach and intestine due to passive diffusion, which is transformed in the stomach into salicylic acid and acetic acid. The main mechanism of aspirin to perform inside the body is to limit the production of chemical substance called prostaglandins and balance between thromboxane, which promotes platelet aggregation, and prostacylin, which inhibits platelet aggregation. That's why aspirin is used as an antiplatelet agent. Now let's discuss the molecular formula of aspirin, also known as acetyl salicylic acid. Its molecular formula is C9H8O4. Aspirin is synthesized through an esterification reaction between two components, which are salicylic acid and acetic acid, in the presence of an acidic catalyst. There are several medical conditions that require the usage of aspirin, as the prevention of CVD or cardiovascular diseases, as we mentioned before that aspirin is used as an antiplatelet agent. The second medical condition is colon cancer prevention, according to recent studies and after tests have been made on rodents. Aspirin inhibits the growth of colon tumors. The exact mechanism is not known, but it may involve the suppression of cell proliferation or the activation of an immune response. Aspirin is used to reduce the inflammation in the coronary artery wall, so it is used to treat rheumatic fever and Kawasaki disease. The last medical condition is inflammation in general, as aspirin acts as an antiplatelet agent to reduce the production of prostaglandin. The side effects of aspirin. Aspirin can cause severe effects if not consumed wisely, as gastric pain, internal bleeding, and hepatitis, hypersensitivity reaction, bleeding ulcers, and indigestion. The second NSAIDs medication is acetaminophen. We will discuss its history, mechanism, chemical formula, medical condition that requires its consumption, and side effects. Firstly, let's begin with the history of acetaminophen. It was first introduced to the medical market as a fever and pain reliever for children. It was known for being gentle to the stomach, unlike aspirin, which was known for causing a severe irritation to the stomach. Moving on to the mechanism of acetaminophen. Acetaminophen, as well as aspirin, reduces the production of prostaglandins, but unlike aspirin, it doesn't have much of an anti-inflammatory effect. Now let's discuss the chemical formula of acetaminophen, also known as paracetamol. It doesn't belong to the group NSAIDs because it has less of an anti-inflammatory effect. Its molecular formula is C8H9NO2. Medical conditions that paracetamol is used in. The first medical condition is called PDA. It is believed that paracetamol can treat ibuprofen-resistant PDA. PDA is a condition that is commonly shown on newly born infants. Its symptoms is shortage of breath, poor growth, and heart rate exceeding the normal range. The second medical condition is rheumatism. Paracetamol is used to relieve joint, neck, and back pain caused by the infectious diseases. Moving on to the side effects of using paracetamol. From the side effects of using paracetamol is causing a liver disease. The last medication is ibuprofen. We're going to discuss its synthesis, chemical formula, and side effects. The molecular formula of ibuprofen is C13H18O2, and it is considered as a weak acid of pH 4.4. The synthesis of ibuprofen is carried out after a reaction of Friedel-Crafts between isobutylbenzene and acetic anhydride. The side effects of ibuprofen can be fatal, as heart strokes, stomach bleeding, dizziness, headache, and fever.